an illness that is unfortunately been sweeping across the country called enterovirus D68. That's a very specific strain of this particular virus. And actually was first identified right here in California in the 1960s. But it is reemerging now today, and it is primarily affecting children across the country, including here in California. To date, it has hit 43 states. And unfortunately, we are hearing about cases first in Southern California, now in Northern California here. So now I'm only an Assembly member and chair of the Assembly Health Committee. I am a pediatrician. I still see patients. And I'm a parent. I have 2 young sons. So I understand the concern that parents have about this virus. And I think that's why it's so important that we're here today to come together and bring awareness to talk about some of the simple things families can do, things that we can do to help try to protect ourselves. But first, let's talk a little bit about this virus, this enterovirus D68. Enteroviruses are fairly common viruses, although this particular strain, instead, is one of the more unusual ones. It is spread from people to people, person to person, through infected surfaces. When someone coughs or touches a surface, they can easily transmit the virus, and then someone else touches that surface, and then they can get infected. So it'll live on different surfaces that people touch. But also, like many illnesses, perspective is important. So while certainly we've heard the stories about how children have gotten this disease and have ended up in hospitals and intensive care units, most people who actually contract this virus don't develop any other symptoms than a runny nose or a cough. So not even everyone gets a fever. Some gets a fever and sneezing and an ache, and they think they have a cold. But the most important sign to look for is really trouble breathing. That's the sign that parents should be looking for, because it does appear that children with asthma are more likely to develop significant symptoms. And of course, it is important to keep in mind that even with the increase in this enterovirus D68, its impact actually is not as severe as that we see from the flu most years. In fact, on any given year, tens of thousands of people pass away from the flu, including last year we had many people who died from the flu. And so fortunately, enterovirus D68 has not come anywhere close to the flu. However, it is a new condition that parents rightfully should be watching for and being concerned about. And certainly I, as a parent myself, know how concerned parents are when they hear about this serious disease. So there are 7 key things that everyone can start doing to help protect themselves from infection from whether it's enterovirus D68, which is what we're talking about today, or many other viral infections as well. Because viruses are primarily transmitted through contact. So someone who sneezes, and they sneeze into their hand, and then they touch a doorknob or a telephone or a keyboard. The germs, these viruses can often live for hours, depending on the virus, sometimes even weeks, and then they can be picked up by the next person who touches that object. And so we encourage people, first of all, wash your hands. Wash your hands frequently. You should try to count to about 20 when you wash your hands. You want to wash your hands anytime you actually put your hands up towards your face. You should consider washing your hands to be sure that you're not connecting, and try to avoid taking your hands to your face. Because the other thing is that when you cough, most of the time when they cough, people cover their mouths with their hands. That's usually what most of us were taught when we were growing up. But actually, we don't want you to cover your mouth with your hands, because then your hands touch something. I think many of the kids are now learning to do what I call the vampire cough, which is, of course, quite appropriate. Now we're in October to do this. So the germs are in and then the hands are clean. So that's what we want to do. So if you feel like you have to sneeze or cough, do the Dracula cough. So we want to cough into your inner elbow or upper arm. And certainly we want to discourage people from coughing into their hands. So we got to keep the hands clean. I talk a lot about keeping hands clean, I think, in office. So certainly we want people to learn to do this so it's second nature, because I think a lot of us, unfortunately, second nature is to cover with our hands. And as we approach cold and flu season, these tips are crucial. So we want to keep people healthy, try to limit the spread of infection. We don't want have anyone get sick. People want to continue to go to school, go to work. So it's really important to do that.